the end of this calendar year or January or February, you hear this all the time, especially from politicians, that would be a fool's paradise. I think it's much more important for us to think about protection, prevention, and dealing with life in the new reality. Here you can see, and I won't go through these in great details, but in terms of the number of cases and sort of an upper and lower limit for the contagion scenario in India. And let's just, again, pray that we don't get to this upper limit, which is showing over 6 million cases. Let's hope that this can be contained. So what can we do? And this is really what I want to focus on in the brief presentation today, and then leave time for questions. In the absence of a vaccine, which induces herd immunity, the concept of herd immunity being that the vast majority of the population has protective antibodies, it's herd immunity. We don't have that. We're not close to it. And in the absence of medications that will abort the infection quickly and shorten it, we don't have those. We must reduce the risk. It is a highly transmissible virus, much more transmissible than its precursor SARS from 2003, and certainly along the lines of other coronaviruses that cause common colds. It's highly transmissible. We must reduce the risk. By now, you all know social distancing. In the US, we say 6 feet. I'm not sure in India if it's 2 meters, 3 meters. Masks, universal masking when you're in public, especially if you cannot socially distance. Strict hand hygiene. I tell my patients every hour to 2 hours, wash the hands. It doesn't have to be hand sanitizers alone, could be soap and water for 20 seconds. But these are the things that we have. They're not high tech. But I want to talk about something additional that we can do. We know that this is an opportunistic infection. What does that mean? It preys on the vulnerable. People with chronic conditions, diabetes, high blood pressure, heart disease, etc. These people are at high risk for progressive disease, mortality. In the United States, the recent surge has been more in younger populations, whereas a few months ago we saw it in the elderly. But one of the things that people should do, and this is everybody in society should work very hard to control these conditions. So if you have high blood pressure, this is a good time to see a doctor and get it under control. Get the diabetes under control. It's been shown that dysregulation of these conditions significantly, exponentially increases the risk of worsening disease. The other thing I want to mention, and this is something that I think is particularly relevant in the Indian context, is the concept of adult vaccinations. We maintain vaccine schedules for our children very, very carefully. Everybody follows the rules, follows the guidelines. India's rate of adult vaccinations for preventable infections, and there are 2 of them here, influenza and pneumococcal pneumonia, which, by the way, kill millions of people each year. These are, if you add up their impact, far greater an impact than the COVID-19 virus. In the United States, the guidelines state that at least 90% of the adult population, generally above the age of 60 to 65, should be immunized. And we're close to that. In India, it's about 1%. So this is something I'm going to explain to you in a little bit more detail why these are so important. But focusing now on how to prevent the complications of COVID-19 is where it's at. Visit your doctor. This is important. Sounds obvious, but it's important. By person, by teleconsult, better control of chronic conditions, as I mentioned, your blood sugar, blood pressure, better control of weight. These things do improve outcomes. The worst possible scenario, and this has been said by many infectious disease specialists in the United States, would be a confluence of two epidemics. COVID-19 is bad enough. We don't need anything more. If influenza, the seasonal flu, reaches high levels, that combination would be even more disastrous for society. There's a reason to be scared about this. Around the world, this has been data from the United States, from Australia, from many countries, because of the use of masks, because of hygiene and social distancing, the influenza epidemic has greatly reduced. In fact, in our own state here of Illinois, they were saying that during the time of influenza season, which goes until late March, we had 0 new cases. That has not been seen before. And that's largely because of social distancing, hygiene, masks, etc. With that comes a potentially serious complication, and that is that immunity to influenza is also reduced significantly. So if we do see a surge, there could be a particularly vulnerable population. And as I said, that nightmare scenario of 2 epidemics at the same time. So vaccinations save lives. We know that year in, year out. This year, probably more than any year in recent history, adult vaccinations are important. And if you look at the people who are at risk for influenza, for pneumococcal pneumonia, they're actually very similar in the risk profile. The age, comorbidities like diabetes, heart disease. The one difference may be a little bit greater tendency in people with high BP for COVID. And this is something that is right now, I'd say, the bane of existence for the southern and western parts of the United States. The new surge is happening in young people, people in their 20s, 30s, 40s. And the mortality rates in this population are very low. People get like a bad flu or a bad cold, and they feel like they're pretty much immune. Therefore, you see pictures on the news of young people in bars, going to parties, congregating at beaches, feeling as if there's nothing to worry about. There actually are what are called COVID-19 parties, where people are getting together to try to transmit the virus and create some kind of herd immunity. This is the height of stupidity, because first of all, some young people do succumb, very rarely, but they do get very sick. But second of all, we all have parents, grandparents, and the spread into those risk populations can be disastrous, as we've seen before in nursing homes and other areas. So young people, pay attention. People who are going back to work, and we're going to talk about that in a minute, pay attention, because you don't live in a silo. Other people can get the infection from you. Likewise, take care of your parents, take care of your grandparents. Vaccinations, primary care. We go back to the basics of health. Now, I want to say a word or two before we turn over for questions about the return to work. Because one of the, I'd say, almost a bigger complication of the COVID-19 pandemic is the economic toll of the lockdown. Trillions and trillions of dollars are being pumped into economies around the world. The European Union announced a $2 trillion program. America is about to launch its second program. India has been doing a lot of this to prop up business and to help people during this time of lockdown. That's untenable. Plain and simple. The world will go bankrupt, hunger will increase, and unemployment will be rampant if we cannot get back to work. And I think everybody agrees that staying at home, locking down roads, and keeping people from earning a living is something that cannot be done beyond a certain period. And I know that the attempts to go back to work have been in fits. Sometimes people get back and then they are pulled back home again because of the lingering concerns of the virus. So what I want to do is just go through, especially for those of you who represent HR agencies or companies, how steps can be taken, what's called environmental hygiene and employee health, to try to return to work and maintain productivity. Again, where possible, encourage work from home. The tech industry has done this very, very well. Twitter announced quite a while ago that its employees would all just work from home. The need to go and congregate in an office probably isn't that great in many companies. So where possible, minimize the crowds. Keep social distancing. Many workplaces are being redesigned now so that there's a space of at least 6 to 8 feet, putting up plexiglass or some kind of cubicles to keep the spread of the virus, which, as you know, can be spread aerosolized, not just droplets, but in an aerosol fashion. So we have to be very careful about that. Wearing masks at work, regular hand hygiene. If you're in the office, if you're in schools, every 1 to 2 hours, just doesn't matter what you're doing, what you touched, wash your hands. Very important. Temperature checks at the entry points. This is being done many, many places. Airports are looking at this. And so the concept being that we keep people who are unwell out of crowds and away from spreading things. So the old days, and I'm hoping that some good things come out of this, the old days of going to the office and having somebody in the room with you who's sneezing and mucus all over the place and really quite disgusting, they should be over. We should not be doing that anymore. People should be encouraged to stay at home when unwell. And that's what I was saying here. The other thing to think about are the concept of break rooms. So having everybody take a break, congregate around a water cooler or a tea dispenser or in a break room, all of that should be gone. So if you're planning to reopen, I know it's great to have employee morale and a place to take it easy. Employee morale will actually increase when people have their jobs. And so avoid these big break rooms. The idea of directional flow, those of you who go to the store and you see the arrows on the floor to walk in certain directions. And the idea is to have, or to avoid people walking in opposite directions where there may be a higher risk of aerosolization. Closed spaces. And those of you who work in buildings that have elevators, and I'm sure many of you do, be careful. The SARS-CoV-2, the coronavirus, has been shown to persist in small aerosolized microdroplets for up to 16 hours. That means if a group of 3 people go into an elevator, one of them coughs or they're talking loudly, which increases the amount of virus that's released, that elevator potentially has viable infectious particles until the next day. You go in that elevator, it's a risk. So might be a good time for people who don't have too many stairs to do. Think about it. Get into shape, do some stairs, or when you're in elevators, wear that mask and try to, again, minimize those types of things. Touching knobs, as you know, the concept of fomite transmission is very important to this disease as well. So avoiding banisters, knobs, doorknobs as much as possible. In fact, many offices are being redesigned to avoid having those knobs where you can touch them. Going back to employee health, so in addition to the precautions to prevent transmission at the workplace, I go back to the fundamentals of medicine. Just like I mentioned with people who are at risk for COVID-19 or the elderly, your employees have to stay healthy. If you want to have a productive workplace, you need people at work, and you can't have high rates of COVID-19 amongst the employed staff. Keep the employees healthy. Primary care. The rate of chronic diseases in the Indian workplace has been estimated to be as high as 50%. Blood pressure, diabetes, obesity, heart disease, kidney disease, etc. An unhealthy workforce will not be competitive in the era of COVID-19. It's never competitive, but it's even worse or compounded with this pandemic because, again, it preys on these people. Keep your employees vaccinated. As I said, having a flu outbreak in the middle of a workplace while tackling COVID-19, that's a disastrous situation. So employee health. So when we think about corporate health, how to return to the workplace, engineering changes, social distancing, trying to promote telework, staying at home if possible, avoiding congregation, keeping employees healthy in general for chronic comorbid diseases, and keeping them vaccinated. All very important parts of this. So I'm going to stop there so we have some time for questions. And, my wife always says that the Indian practice of namaste is probably the best of them all in terms of not touching someone, hugging or shaking hands, things like that. And more it's becoming a practice in the United States and the West because, again, this is our new normal. Get used to it, wear your masks, do the things that work for public health, but above all, take care of your health. Stay healthy and think about prevention. So thank you all, and I think we'll have some time for questions, and maybe Gaurav, you're going to moderate that.
Thank you very much, Dr. Ravi. This is really informative and much relevant also because in India, there are so many conception and misconception we are living with. And COVID is, despite of all good initiative taken by the public health departments and the government and ministries, it still is a mystery. So I hand over the task of taking questions to Dr. Richa and encourage everyone to please ask your questions. If you feel that any of your relative or you have any phobia related to COVID, please feel free to ask any question. We have Dr. Richa and Dr. Ravi on board with us. Thank you.
I noticed one of the questions while the presentation was going on about herd immunity. How long will it take in India? I think it was a lady who had asked. I don't remember the name. Dr. Ravi, could you please enlighten us if you know
Certainly.
something? Yeah.
Yeah, thank you. That's a very good question, and it's the I call it the utopian ideal. That's what we want. We've had herd immunity to things like measles and mumps and other diseases, and it's been effective. There are 3 points I want you to take home about this. One, we're dealing with a different virus. So when people say, well, we've done herd immunity to measles, we should be able to do it to SARS-CoV-2, the answer is no. The coronaviruses are notoriously hard to direct immunity. Anyone who's had a cold, common cold, will know this. You can get multiple colds every year, and you can get them every year of your life. Those are mostly coronaviruses and rhinoviruses. So the concept of developing uniform herd immunity, where 95% of the population has protective antibodies, very, very difficult. So we're dealing with a different virus. Number two, even if many people get sick, and I think today's number, I can't remember, we're approaching 14 million people in the world who now have coronavirus. 14 million is a lot. There's 7 billion people in the world. So everybody pull out your calculators and you can figure out that we're dealing with a fraction of the population of the world that's been infected. That's assuming that if you're infected, you won't get reinfected, which, by the way, is a bad assumption. So this concept that the world may develop herd immunity through infection, forget about it. Okay, the world will die before that point, because that means you need huge numbers infected, and you know that many people are vulnerable. So that's not a good concept or good idea. So really what that brings us to is vaccines. All right, if you have a new virus that's hard to protect against, you have really a small fraction of the world that's infected, you need to vaccinate. You need to vaccinate billions and billions of people, which I think would be the miracle that will save the world here. And there are many, as I said, many vaccines are under development, but keep in mind that for the vaccines to work, the vaccine must inherently induce antibodies. Those antibodies must protect against the virus, and they must be durable. They must last. If the antibodies drop in a month or two, which is one of the worries, they won't protect. You have to constantly vaccinate. And above all, and this is so important, and I think very important in India, where adult vaccination has not been accepted and caught on, people need to take it. Even in the US, people, up to 30% of people who are surveyed say they may not take the vaccine. Again, I look at that as a very, very short-sighted practice. When a safe vaccine is available, I can't tell you if it's a couple of months or a couple of years, people need to take it. So herd immunity, fantastic concept. Hopefully we get there. I would say don't hold your breath. Let's deal with what we have now.
I noticed another question. I would request everyone to please keep typing your questions. I'm noticing them. The other one that I come to is someone had asked about elderly, those who are vulnerable, how to protect them.
Certainly. The best thing you can do is to shelter the elderly. Unless absolutely required, the elderly, by that I mean, and I don't mean to offend anyone here, but 60 years of age and above, technically, although, the risks, exponentially go up from the age of about 75 and above. But unless you need to be in a crowd, and I don't understand why everyone has to be in crowds, don't. It's boring. You stay at home, you read books, you watch TV, you talk to people over the phone. I know it's boring, but that's what it takes until rates of infection drop in a community. Going for walks, maybe wearing a mask and going for a walk outside, not a bad idea at all. I encourage it. It's a good, healthy thing to do for the elderly. But don't get into crowds. This is not the time to be going to the bazaar and picking through millions of vegetables with thousands of other people. Bad idea. So shelter the elderly. When in social settings, wear a mask. Wash your hands. Practice social distancing. And as I said earlier, the last thing we need is an outbreak of influenza in the elderly. A 70-year-old man with diabetes or heart disease is at tremendous risk now for both COVID-19 and influenza. That person should be immunized. So this is the time to get real, to get practical. It's not necessarily about what we want to do. Oh, we'd love to walk around in the crowd every night. We'd love to just not take vaccines and, you know, hope that everything gets better. No, it's time to take control of health, protect the elderly, and protect their health with things like vaccines and control of chronic disease. Thank you for that question.
Next question was about the role of rapid tests in prevention in spread at workplace.
Good.
Yeah.
Very good. No, rapid testing, point of care testing, which is being rolled out now. You can get an answer in 10, 15 minutes. It's very useful. I can tell you where I think it's probably more useful will be in settings where there's very high risk. So for example, elder care facilities, nursing homes, hospitals, places like that where you need to find out who's infected and remove that person from the mix. Okay, the whole idea is to, you know, in a way, it's like a form of contact tracing, is you take that person, find out their contacts, and move them out of the mix. Now, in the workplace, certainly if a company can invest in that and make sure that the people that come to work are uninfected. Probably a great example of this, I don't know, I know in India it's not such a big deal, but here, I love baseball, and baseball is the passion of America. And yesterday, baseball season restarted, which is great. The players are going to be tested regularly. So if someone tests positive, they don't come to play. So the whole idea is to separate those who are actively infected from those who are not. So if a company were to do this, let's say every day you go to work or at some periodicity, they test everybody. Keep in mind that some of these tests are about $200 each here. I don't know what they are in India. It's expensive. So it could be used. My advice would be the things we talked about: practice precautions and be prudent about the workplace setting. It's probably a more cost-effective way to keep infections down. Thank you for that question.
I would like to answer a question. It's about how risky is it to go to the hospital? Somebody had asked. If you take proper precautions and you know why you are going, it's better to go for a teleconsult first. We are having telemedicine at our disposal now, which is a great tool to screen out those patients who really need to visit a hospital. And it can be one-on-one with the doctor. It can be, but first the PCP, the primary care physician. And then the physician can actually direct you to a specialist if the need be. And if required, then you can come to the hospital. That would be my suggestion at this point. This question goes to Dr. Ravi about reinfection and opening of exam centers and universities and schools.
Great. Well, there's actually two parts to that question.
Yeah, there are two questions to that.
So reinfection, very, very good question. This is a concern. As I said to you during the talk, SARS-CoV-2 is a coronavirus. And coronaviruses reinfect hosts. Well-known fact. Those of you who've had a cold will know this. And it has to go back to what I said about immunity. And is there lasting immunity that's being formed? It's been shown, several recent studies have come out showing that people who develop COVID-19 disease have a rapid drop in their antibodies in their blood within a matter of weeks, within a matter of 6 to 8 weeks. So if those antibodies drop that quickly, theoretically, yes, people can be reinfected. There have been people who reported that. So reinfection after natural course of infection could happen. It is happening. And that also assumes, of course, that those antibodies are effective. As I said to you, you can have all the antibodies in the world. If they don't neutralize the virus and they don't do what they're supposed to do, then you're susceptible. And as far as, reinfection after a vaccine, this certainly happens, as you know, with influenza. That's why there's annual vaccines. There's a lot of mutation. So it's a little early to talk about post-vaccine course because no one's been vaccinated yet, but that is a concern again. So reinfection is something, this concept of an immunity passport, which I know has been tossed around. You carry around some kind of, document that you've had coronavirus infection. At least at the moment, based on science, that's a bunch of nonsense. There's no proof that there's lasting immunity. What was the other part of the question? There was a second part. Oh, schools.
Yes, about schools and universities opening up because people have pending exams in universities.
Right.
Not everyone has access to, remote learning and home education. So.
Right. Well, I can tell you that, let's start with universities, because we're talking about people in their late teens, early 20s. That's a group where there can be a sense of invincibility. People say, oh, I'll just get a little ill, but everything will be okay. Again, that works if all those people are sealed off from society. If those people interact with their professors, many of whom may be in high-risk groups, they interact with their parents, grandparents, and greater society, that group of people that are all crowded into rooms, touching things, sharing the virus, can bring down our society. So if rates of infection are high, and again, there's some data, if you follow anything that's coming out of Florida, rates of test positivity may exceed 20%. So that's a high rate of infection in a society. It's very unwise to put those people back together in crowded settings. Now, does that set back the course of study and create hardships? Absolutely, it does. But that's something that in the bigger picture, the public health impact of it may be better. So it does seem premature to put people back together in crowded settings. As much as possible, distance learning, or take your classes and break them into shifts. So instead of everybody together, some people show up in the morning, some show up in the afternoon. None of this is easy. And everyone says, oh, but that means we need to do this. We have to open longer. Of course you do. But you need to find a solution. As far as children in schools go, a little bit different in that the actual risk of children getting severe infection is very low. The transmissibility of the virus amongst children and between children and others seems to be low. But again, the data, the evidence, there's a lot of conflicting views. And it's a hot button topic, as you know. I mean, parents want their children back in school so they can get back to work. And politicians want people back to work so the economy starts to move. Many, many factors here. But in the current situation, most public health officials, most pediatricians are saying that it is unwise to have everybody back in school at this point. Maybe delaying into the fall a little bit longer. that might be a way to do it. But at this point, bringing large crowds of people, because again, those children are around teachers. Teachers may be vulnerable. Teachers and the children's parents, grandparents. That cycle of transmission is what should be avoided if possible. So I'd say it's still premature to congregate people back in schools and universities.
Thank you, Dr. Ravi. As a parent, I really was looking forward to this answer. Another question that came up during this was, what is telemedicine? Some of you do not know. अगर आपको नहीं पता है तो आप पता करिए. फोन नंबर पे बात हो सकती है डॉक्टर से. और मैं ये हिंदी में इसलिए बोल रही हूँ कि आप लोगों में से कुछ लोगों को अंग्रेजी शायद उतनी समझ में नहीं आ रही. तो अगर आपको डॉक्टर से बात करके ही तसल्ली हो जाती है कि मुझे हॉस्पिटल जाने की जरूरत नहीं है, तो ये सबके लिए अच्छा होगा. आपका प्रोटेक्शन है, बाकी सबका भी प्रोटेक्शन है. तो हम छलनी का काम करेंगे. जिन पेशेंट्स को आने की जरूरत है हॉस्पिटल को, उनको हम जरूर बुलाएंगे, क्योंकि स्ट्रोक और हार्ट अटैक ये सब बीमारियां चल ही रही हैं, गायब थोड़ी हो गई हैं. कोरोना वायरस तो है ही, साथ में बाकी जितनी पुरानी बीमारियां थी वो भी चल रही हैं. और उनको बचाना, उनके जो डेंजर साइंस है वो हम फोन पे ही पता कर सकते हैं. तो ये आपको भी सुविधा होगी अगर आप पहले फोन पे बात करें अपने प्राइमरी केयर फिजिशियन से और उसके बाद हॉस्पिटल जाने की सोचें. Next question that someone had asked about mental health of students. I think it was a teacher. You know, during this homeschooling time, I'm seeing it in my own children. And homeschooling is very tough. In a household where both the parents are working and you do not have access to, you know, put a net nanny or something to regulate their screen time, leaving them to their own devices and going to work is quite stressful for me. So I wanted to know what to do during this time.
Is that for me?
Yes.
Okay, thank you. Sorry, Dr. Rich, I wasn't sure if that was directed to me. No, the mental health impacts of the COVID-19 pandemic are staggering. As you probably know, mental health issues affect nearly 50% of the population in the best of times. So given the wide prevalence of depression, anxiety, and a variety of these conditions, the last thing the world needed was the pandemic to just make it that much worse. So there are many, many categories of mental health concerns that are coming up. So the anxiety of what's happening in our society, watching terrible news, worrying about your loved ones, the elderly. These are very serious concerns. Incidents of insomnia, nightmares, you know, depressive behaviors, alcoholism, substance abuse. All of these are on the rise to very unhealthy levels. And then when you think about the mental health of children, having to stay at home, not able to play, not able to have that normal social structure of a school. And the schools, you know, as we all know, and I, as a parent myself, I mean, the schools provide not only education, but they provide the social fabric for children. And for many children, they actually provide the food. So not having these things has created, you know, tremendous problems, and children, of course, can't articulate this quite as well as adults. But abnormal behaviors, again, sleep disorders, and worrying, these are things that are now quite endemic. And there are many you've seen, probably even like Dr. Richa says, with telemedicine, telepsychiatry, telemental health services that are available. You can access someone, a counselor, a psychiatrist, to at least discuss these things. I encourage it. It's not necessarily my field of expertise, but I can tell you that just talking about these things, sharing the feelings with a healthcare specialist is a very, very healthy way to address it. And for those who can access that, or can at least talk to your family doctor. Family doctors are trained to at least recognize symptoms of common psychiatric disorders or depression, and can either manage it to an extent or recommend referrals. And in the case of pediatrics, this is something obviously that should be handled by a pediatrician with potential follow-up. So this is going to be with us for a while, and society doesn't do well when it's excuse me, when it's scared every day by what's out there in the news and what they see. Talk to someone. And once again, the role of the family doctor, the GP, to at least guide and help people cannot be overemphasized. Very good question.
I think a few minutes. I think someone raised a question about the virus being airborne and what does it mean? Quick.
Sure. Quick.
Yes.
It changes the game. Early in the course of this pandemic, the WHO and many organizations did not discuss aerosol transmission. Very quickly, aerosol transmission, micro droplets, very small particles that linger in the air. Droplet transmission, drops. When you cough, when you sneeze, they travel about 6 feet. That's where we get our social distancing from, based on droplet transmission. But now, the responsible side of the WHO and others has come out, and they're saying that aerosol transmission exists, which it does. And therefore, as I mentioned to you with the elevator analogy, if you go into an elevator and someone's coughing, you're worried about droplets. But if you go into an elevator where there's nobody there, but 100 people were in it in the last couple of hours, you're worried about aerosol, things that linger in the air. The best way to be safe, wear a mask. It may not be comfortable, but wear it. And that's the thing to do for now until we can reduce the level of infection.
I think that was it. The last one was about how safe is it to go to the park for a walk?
Assuming your park is safe, that's great. But again, a couple of things.
Open areas.
Yeah, open areas in general. It's interesting. I was reading that the air in Delhi has never been this pure as it has, during this period of lockdown. So it's actually, a nice time to enjoy probably better air. Normally, unfortunately, Delhi has a reputation of very bad air, and that alone can cause problems. But in general, getting outdoors, doing exercise, taking care of yourself should be encouraged. However, here are some concerns. One, if you go to the park and there are thousands of people there, and there are lots of people congregating, it may not be a good idea for the vulnerable populations. Again, I mentioned elderly, comorbid diseases, etc. That would not be a good idea. And maybe going at a time when it's quieter or trying to find an area that's a little more secluded would be a good idea. It's not a bad idea. In fact, it's being mandated in many areas, wear a mask. Now, it's extremely hard to go exercise and to walk briskly with a mask on. I agree. But keep in mind that if there are people around, exercise, talking loudly, singing, things of that sort, increase the aerosol transmission of the coronavirus. More virus gets transmitted into the air. So if you take a vulnerable person, again, take your 75-year-old gentleman who's obese and has diabetes, and you stick that person in the middle of a crowd without a mask on, even if he's walking, there's a great risk. So overall, I encourage it, but avoid crowds, wear a mask when possible, and be prudent, be cautious. That's the important thing.
Thank you, Dr. Ravi. I think that's all the questions that were asked that I could read. Yes.
Thank you.
Thank you very much, Dr. Ravi, and thank you very much, Dr. Richa. These are very pertinent questions. May I now request Captain Chalapati, CEO of DKR India, to say a few words.
At the outset, let me thank Dr. Ravi for a wonderful presentation, and followed by, most importantly, the question and answer session. Thank you all the guests, and let me say a few words about what DKR does. DKR has been founded by Dr. Ravi Durvasula and his wife, who is a neurosurgeon by specialization and also MIT doctorate in operations management. That's a wonderful and great deadly combination, I would say. And it has been their vision to promote primary and preventive healthcare in India of a quality and standard that is seen in the West. Those who practice evidence-based medicine understand what I'm speaking. With that in mind, we follow the concept of the 5 Ps: patient-centric care, primary, preventive, population-based, and the proactive nature of maintaining the health of the patients in a very responsible manner. We navigate them to specialists on an as required basis, and also take care of them in a longitudinal manner. It is not an episodic requirement to maintain primary health of the people, but it is important to take care of their health in a longer and in a more evidence-based fashion, where you can see the outcomes, actually measure them, create evidences. The population-based medicine helps you to customize for communities based on a lot of data that has been studied upon. Dr. Ravi in particular has been not just a great physician and an infectious diseases specialist, but he has been involved in occupational medicine for workplaces. He advises people on establishing community medicine programs, and so much. With that in mind, DKR has been set up in South Delhi in the diplomatic enclave, and we would be happy to share more information. Let me thank all the participants for a wonderful participation. Some of the questions have been extremely good and very informative to all the people. Thank you, and Jai Hind.
Thank you. Thanks a lot. It was a pleasure to have you all with us. We will send you a feedback form shortly along with a questionnaire. Even if you have some questions you want to target to Dr. Ravi or Dr. Richa, feel free to ask. Thank you once again.
Thank you.
Thank you. Thank you all.
Thank you.